Welcome to Module 6, Workflow and Patient Satisfaction. In this module, we will go over what the typical workflow of a telemedicine visit looks like from start to finish. We will then apply that workflow to a few scenarios. Lastly, we will look at patient satisfaction outcomes. The objectives for this module are to identify the importance of workflow, to list the desired outcomes for patient satisfaction, and to identify positive and negative messaging practices. This module will provide a step-by-step guide for creating a successful workflow. Patient satisfaction will also be discussed. The content has been designed for a clinical audience with minimal exposure to telemedicine. First, let's review which care centers are most likely to have telehealth or telemedicine capabilities. These are teaching hospitals, larger healthcare systems, rural hospitals and clinics connected to affiliates, nonprofit institutions, and those with additional advanced medical technology. Even in the most ideal settings, barriers may persist, including effectiveness, state policies, especially those related to private payer reimbursement, regulatory infrastructure, and unintended consequences, which we will discuss. Workflow benefits from having a systematic process. Keep in mind that building a rapport between patients and physicians can be affected by the personality, communication, education style, and the physical environment of both parties. Communication throughout all scenarios should be based on the needs of individual patients and their families. A study done by the Royal Australasian College of Physicians looked at practical aspects of telehealth and estimated that only 7% of emotional communication takes place verbally, and 55% by posture, gaze, and eye contact. Understanding the impact of these communication styles will help you as a provider make a good first impression and to set the tone for what is to come during the visit. We will notice that this is a recurring theme throughout the workflow. When preparing for a visit, check all equipment. Weekly equipment checks are best and are meant to be done 15 minutes before the visit. Practice with equipment. Check that the audio and video components are both working and ensure that your image is in the middle of the screen and zoomed in so that you are clearly visible at the patient end. Make sure that the originating site has sent all patient documents in time for the documents to be reviewed prior to the session. Inform others that a telemedicine visit is taking place and request a quiet environment and privacy. Assure that the rooms are quiet. Close open doors and place a Do Not Disturb sign if needed. Check for external sounds and ensure windows are closed. Next, we will discuss starting the visit. You should mute microphones until the visit begins and silence any phones in the room. Ensure that the patient receiving care is comfortable and in the correct position for the camera and microphone. Ensure the patient's privacy. Be sure you have the patient's permission to conduct the telemedicine encounter. Introduce everyone involved in the visit. Introduce yourself and any colleagues on your side and greet parties, and any specialist or presenter on the patient's end of the consultation. Explain that whatever is covered in a traditional face-to-face consultation will be covered in the video consultation, and that the level of service will be the same. Describe what will happen if the technology should fail during the visit. Explain what will happen in the unlikely event that an emergency occurs with the patient. A provider should be aware that taking on any patient is still at their discretion. For example, you might terminate a visit if you assess that a patient's cognitive capacity may require an in-person examination instead, or in a case where the patient's particular problem is not suitable for a telemedicine visit. When conducting the visit, you follow your normal procedures, as you would in a face-to-face encounter with a few guidelines. Confirm the identity of the patient. You may want to spend some time discussing family, home, or other social matters to build rapport, as you would in a face-to-face consultation. Maintain eye contact with the patient by effectively using the camera and zoom in and out to pick up any nonverbal cues. To improve communication, make use of visual aids such as imaging or drawing on whiteboards to support verbal explanations. If the consultation involves the discussion of sensitive information, encourage family members and/or health professionals to participate in the video consultation at the patient end. Summarize the consultation and check the patient has understood. This can be done using tools such as the Teach Back method. You can find additional resources on the Teach Back method from the AHRQ at the link ahrq.gov. Before completing the consultation, give the patient an opportunity to ask questions, then ensure follow-up appointments are made. It's also a good idea to document the quality of the connection in the patient's chart. The quality of the connection may determine whether a proper assessment of the patient can be made. Ensure all documentation is complete in the medical record and forward a summary of care to the referring physician as appropriate. Turn off and store equipment. Report any technical concerns to those responsible for maintaining the equipment. Let's look at 3 types of scenarios where we can see how an example workflow is used. The goal throughout the visit is to respect the patient as well as the team members. Let's look at some common interactions which are likely to take place. Live, synchronous telemedicine visits are likely to be found when there is an established and ongoing relationship between the patient and provider. These visits can be used as follow-ups or for typical problems found in urgent care such as sore throats, colds, coughs, or common flu symptoms. In preparation, review the medical record and familiarize yourself with the patient's situation and check that the equipment is working as needed. Self-monitor your position relative to the camera and place it at an appropriate distance so the patient can easily see you and your expressions. As the session is started, complete introductions of members, caregivers who are present. Follow with a, "Hi, it's great to see you. Thanks for doing a video visit with me," to serve as a formal welcome to the visit. Next, the communications could be, "Isn't it great that we can meet to assist you without a long drive?" This helps to remind the patient of the purpose and value of the telemedicine visit. Also on the screen, we see an ideal scenario. We see the walls are neat without too many photos and nothing personalized. The lighting is indirect and not from under or over the provider's face. The provider looks professional and tidy. It's also appropriate to wear your name badge, even if you were taking calls from home. It establishes authority. Of course, be engaged and smile to put your patient at ease. If applicable, ensure that before the visit ends, the patient has an understanding of their diagnosis, their plan of care, and next steps. It is also advisable to dictate directly after the visit so the visit is well documented. This slide shows a compilation of photos of what not to do. In the first slide, the provider is too close and a window is directly behind his chair. This is distracting and puts a glare on the screen. In the middle slide, the provider is seated correctly in the middle of the screen, but all of the lighting is from the back. This is a common problem in most offices. Check to review your positioning and lighting ahead of time. This provider's face cannot be seen. It is daunting to speak with someone in the dark. The last photo is clearly too bright again. Remember, all indirect light. No windows or doors behind you. Check your image before you meet with the patient. As discussed in prior slides, make sure you have prepared by first reviewing the patient's record. Confirm the patient's identity and chief complaint. Sightlines have previously been discussed. Make sure you can be seen and heard. Be transparent. Let the patient know if you have to look away so they know you're not simply distracted. For instance, explain your movements as it happens. Make sure to use clear, succinct explanations, such as, "I'm looking at your file to review your last test results." Build rapport by making a common practice of personalizing and reinforcing patients' previously held anxieties. Ensure you are actively listening to patients' or care team's concerns and thoughts. Be aware of your nonverbal communications, such as looking at the clock, your watch, or other items in your office. Lastly, when it's time to wrap up the visit, review and ensure that the patient, caregivers, and our care team understands the diagnosis, the plan of care, and next steps. Let the patient and family know that you are available if problems should arise. This helps the patient and family move forward with confidence. Make sure to finalize all documentation in the medical record directly after the visit to ensure all information is gathered and send any summaries of care as appropriate. The acute care method has supported practices in telestroke, telepsychiatry, emergency department, and specialty consultations provided to clinicians in rural areas, including virtual ICU support. In acute care interactions, we find a similar workflow. When developing an acute care workflow, the focus has been on how the two care teams are meant to collaborate. Pathways in acute care interactions have stressed the following: Ensure you have the correct patient and the encounter is taking place in the correct room. In identifying the patient, ask the patient about the caregivers who are present. Introduce the providers and telepresenter at the patient site. Verify the attendance of all of the parties in the room. If applicable, educate the patient and the family about the reason for the encounter. Also consider the following: the placement of the cameras on the telemedicine cart, the location of the telemedicine cart. A workflow with a heightened stress on sightlines should be created, which will make it easier for the patient to interact without too much effort. Also avoid the possibility of the care team obstructing the visit due to movement of the care team in front of the camera. Remote team and originating team should have built strong communication pathways for a complete comprehension of the objectives and approaches that should be taken to have unobstructed sightlines of the patient at all times. When using secure messages, prepare for the secure message by reviewing previous messages and the medical record. Guide the care through secure messaging as opposed to formally diagnosing the patient. Communication should be simple to understand and personalize the message. Be up to speed with the message thread. This has higher relevancy in cases where specialty clinicians are being brought on board midway through care. There are situations when it is best to call patients or request they make an in-person appointment when complex responses are necessary. When a patient has been requesting insight on the same issue multiple times, or when negative or sensitive information must be disclosed. Patient satisfaction outcomes of telemedicine have been largely positive. Geographically speaking, satisfaction is generally found to be higher in rural than urban areas. It is preferred to have a local visit than to budget time for travel to a care center and wait for an in-person consultation. Clinically speaking, patients who use the telephone or video conference for clinical follow-ups report to be largely satisfied due in part because of reduced travel time, cost, and increased convenience. There are various ways to express the same message. For example, you could say, "This visit does not replace having a primary care provider in your town." Or you could say, "I will provide you with online acute care today." If you are assisting a patient for which you cannot help with prescriptions, you might say, "I will help you manage your symptoms." For patients who need longer-term care for chronic issues and you are seeing the patient as a specialist for consultation only, you could say, "I will educate you about your condition today and will confer with your PCP about the best ways to care for you." Let's not close this portion of the presentation without noting that the setting for delivering news of terminal illness or other very serious conditions should be considered before being delivered through telemedicine. Although rapport can be successfully developed in telemedicine, some results are best left for in-person conversations. The stress placed on patient engagement, empathy, trust, professionalism, compassion, and rapport building ensures patients are well provided for, but reaching these goals has a few real-world challenges. Major challenges are that many benefits stated are still theoretical, as studies rarely focus on patient-centered outcomes such as mortality and functional status, and instead focus on the novelty of patient feasibility and acceptability of the technology. Clear evidence for the when, where, and how of deploying an effective program has not been properly documented. The regulatory environment is inherently challenged at keeping up with the rapid change in technology. Barriers stemming from liability, cross-state licensing, and cross-hospital credentialing remain challenging. Moreover, the rapid development of mobile health technology, combined with the use of smartphones, are presenting additional options where regulatory guidance may be uncertain. In summary, this module reviewed the importance of workflow and the desired outcomes for patient satisfaction, and finally, addressed the positive and negative messaging practices.